Tell us more about what Martin was telling us.
So Martin is 56, he's a retired police officer. He was the person actually that was thought to be the ship's doctor, in fact an expedition guide. Our colleague spoke to him last night on the telephone. He said that he'd had various tests, he was waiting for results, that the doctors were going to have a clearer picture later in the week, but that he's doing OK. And the Telegraph has also spoken to his wife, Nicola, and she said that it had been a very traumatic few days, as you would expect, and that Martin had been up and down, started with a mild illness, ended up with more serious symptoms, and is now stable and understandably very relieved to be off the ship. Now, he is one of 3 people who were evacuated from the MV Hondius. A German passenger who was 69 was flown to Amsterdam, has now gone on to Germany. And then you were hearing there about one of the people who was delayed. Now, it's understood to be because there was a problem with his life support system on a plane, so he was diverted to Gran Canaria, then transferred to a different plane and has now flown to Amsterdam. We know that 3 people have died, a Dutch couple, and the first person actually was a Dutch man. That was on the 11th of April. And this is what the captain had to say at the time.
One of our passengers sadly passed away last night. Tragic as it is, it was due to natural causes, we believe. I'm told by the doctor we're not infectious.
Now, another passenger, Rui Genet, spoke to Yalda Hakim and said actually what happened as it emerged, what was going on and how things played out after that announcement.
Then captain said one of the passengers sadly passed away, and it was due to natural causes. We're not we're not in infection. There's no contagious disease, something like that. So this was a relaxing explanation, but this was not the case, because the first death was because of the hantavirus. And after this announcement, we were not ready, or we were not isolated for what was to come. We were together during breakfast, lunch, and dinner timings in the dining room all together. There was open buffet, and we had lecture sessions, group activities. Still, even after the day that we had someone passed away, until my last day, 24th of April, we didn't take any cautions. We were not informed about the situation, and the ship management, I think, didn't know anything about the virus.
Now, this cruise started out at the beginning of April in Argentina, and officials in Argentina, speaking anonymously, have suggested that this may have all started when the Dutch couple who died went on a birdwatching trip at a landfill site. Now, we know about hantavirus, that it's spread through contaminated rodent droppings or urine. It becomes airborne and you inhale it and can end up with a respiratory illness, which, as we know, can be deadly. Now, the Anstee strain of hantavirus is the one we're talking about here, and it's really pretty rare to be passed between people. It has to involve very close contact. So there's lots of contact tracing going on at the moment for people who may have found themselves nearby. It's been also confirmed by the UK Health Security Agency that 2 British passengers who'd actually left the cruise at an earlier date, flown back independently to Britain, they are self-isolating. They haven't got any symptoms. Their close contacts are also self-isolating. And as for the MV Hondius, it is now heading to Tenerife, expected to arrive there at the weekend. Around 150 people on board, all asymptomatic at the moment, but of course no chances will be taken. Everyone will be checked thoroughly and will then be sent home. And it's been suggested that British passengers could end up with 45 days of isolation once they are back home in the UK. So this is going to have a long impact for people. But the overall message is that it's really a low risk to the broader public. This is not like COVID, where you can pass someone and pick it up.